So, in a case like this one, what would you do?
Well, based on the physical exam, I think the best thing to do is ask for a CT scan or an X-ray of the spine to see if there's a fracture or dislocation. Those seem the most likely possibilities. I could also ask for an ECG to check the heart.
Okay, well, I did an EKG, which was normal, and then he had an X-ray done. On the X-ray, you check many elements, including the curve of the spine, the gaps between the vertebrae, the soft parts, and here they were bulging forward.
So that's because of edema caused by a fracture, right?
That's right, it indicates the presence of a fracture. In this case, the patient fractured his atlas. The CT scan revealed 3 breaks. The physical exam I did earlier showed no spinal cord injury.
Can we see or diagnose a lot of things with X-rays? I haven't studied them much yet.
Well, it depends, of course, but with X-rays I've seen quite a lot of things, and not only disorders of the spine. Of course, I diagnosed a case of kyphosis, which X-rays showed clearly, and scoliosis at different stages, when you can appreciate mild curves, or twists and turns in severe cases. But we can come across many oddities apart from the day-to-day work. We can discover many strange or even funny foreign bodies, from the not-so-uncommon forgotten needle by an unfortunate surgeon, to pieces of lead shots either from an unhappy wife or stuffed in an ingested old-fashioned partridge pie, to unconventional piercings. We can get an idea of an unknown patient's age, judging by the osteoarthritis in his or her hips, or his or her gender by the patterns of the ribs, of a previous pregnancy thanks to the pattern of the pelvic bones. It can be quite useful after a plane crash to put a name on a corpse or to explore a mummy without peeling its wrapping. But the weirdest thing I've ever seen is a lithopedion. The patient was a 70-year-old, quote-unquote, pregnant lady. She was still carrying a mummified fetus inside her, a stone baby.
Wow, that's quite amazing.
Yes, it was. So back to the case. What about the treatment and the follow-up?
It depends on the type of fracture. I think isolated fractures don't require anything but a neck collar until the pain disappears. But combined fractures of the posterior and anterior arch, for example, if they're unstable, need an operation maybe, no?
Correct. Now, are fractures of the atlas common?
I don't know. Actually, I don't think so.
They account for about 2% of all vertebral fractures. So what would you explain to your patient regarding car safety?
Well, first he needs to pay more attention when driving, but mostly he needs to make sure he has airbags, his seatbelt on, headrests, good brakes, to check his tire pressure regularly because inadequate tire pressure causes many accidents. Maybe he could also get reverse backup sensors because many accidents also happen when people are backing up without looking behind them properly.
Good. And he can also make sure he has a laminated windshield so that when it's hit, it doesn't break, and that prevents a lot of fatal injuries. Unbelted occupants don't go through the windshield, and he could ask for more padding inside his car, which would have prevented his knee injury.